And it's great to be able to bring you this morning's webinar with Dr. Rob Noonan. This webinar is brought to you by the Northwest Collaborative, which is made up of ourselves, Northwest Employers, MIAA, Northwest ADAS, Aqua, and the Leadership Academy, where we've brought our skills and knowledge together so that we can provide as much knowledge and oversight for the areas that matter to the members across the Northwest. So this morning we have Dr. Rob Noonan with us from the University of Bolton. Rob is a reader in public health and is the author of over 50 public health publications, and has recently just published the book Capitalism, Health and Wellbeing, Rethinking Economic Growth for a Healthier and More Sustainable Future. So Rob will be discussing some of the challenges we have in the on a societal level, and how the health inequalities are increasing due to a lot of these systemic factors that we face, and how we can do something to look at an alternative way. I've looked at the book myself, and it is very insightful, and I would suggest a must read for anybody in public health, policy or politics. So please enjoy the talk. The slides and the recording will be made available after the session today. There will be a number of breakouts and Slido polls as we go through. We don't have any set times for breaks, but please feel free it's to just take a break as required. So with that said, I'd like to welcome Rob Noonan, and I will hand over to Rob. Thank you very much.
Hi, good morning, everyone. Hopefully you can hear me. Thanks very much for taking time to join us today for this particular session. Much of what we discuss here today, as Kev alluded to before, stems from a book that I recently published titled Capitalism, Health and Wellbeing. And to start off with, there was two key drivers to writing the book. The first relates to the work that I do as an educator. And I've taught in higher education now for around a decade, and across many subject areas ranging from public health, sports science, to more recently psychology. And often the material that I cover with students and some of the issues that we discuss in the sessions, they tend to relate to some of the current societal challenges that we face. Things like health inequalities, obesity, physical inactivity, mental health and chronic stress. And one of the challenges that I've often been faced with is signposting them to one book or perhaps a couple of books that gives them a clear sense of how all these challenges fit together, and more importantly, what's really happening and why. So I wrote the book for that particular reason, to fill that gap. But there was a second motivator to writing the book, and this links to the work that I do as a researcher. And much of the research that I undertake focuses on the environmental and the behavioural determinants of health. So how the environment shapes our behaviour and how our behaviour shapes our health. And as part of this work, I've become a strong believer and arguably an advocate for the social determinants of health. And what I mean by that is how our health is very much a product of the places in which we're born, we grow, we live, and we later age. And what's frustrating is, despite the strong evidence supporting the social determinants of health, it largely remains absent from the public and the political debate. And as many people will be aware, over recent years, in the last decade, we've seen how life expectancy has been falling. Health inequalities have been widening. Obesity, physical inactivity, they've all been going up. And more people are taking prescription medication to deal with their precarious lives. And this tells us that something's not quite right. It tells us that these issues that we're faced with, they're not individual level problems, they're societal problems, they're down to structural factors. So I wrote the book for that second reason as well, to stimulate a conversation around how we can achieve a healthier and more sustainable future. And essentially, the book, it throws down the challenge that if we do want this future, then we need to reprogram our economy. Our obsession with economic growth has to end. So today's session will be split into two key parts, really. We'll focus first on the factors driving poor health and health inequalities, specifically in our country, in the UK. And we'll explore how policies can influence population health for better and for worse. And once we've done that, hopefully by the end of today's session, you know, people who've attended today will have a clearer picture of what some of the root causes of the nation's poor health are, and essentially what organisations can actually do to support health and well-being of their workforce. So we'll start off by setting the scene, and once we've set the scene, we'll think a little bit about poor health. And the examples that we'll focus in on relate to obesity, physical activity, mental health and well-being. And once we've done this, we'll move our attention onto health inequalities specifically, before we go on then to consider the workplace, and then we'll summarise what needs to be done to move things forward. What I've done is I've put together a really large slide deck here today, and I'll share it with you after today's session. And in the notes section, what you'll see is a range of different hyperlinks to the evidence that are referred to throughout today's talk, but also some of the resources that I signpost you to. Because due to time constraints, we probably will be unable to go into a great deal of depth for some of the slides that are presented today. And that's largely because we could probably do a masterclass on each of these different topics. But my hope is that by providing a whistle-stop tour of some of these issues, it'll spark a thirst and a curiosity to dig a bit deeper and to find out and investigate the root causes to some of these issues a little bit more. So without further ado, our first interactive activity today is to take a little bit of time just to reflect and consider our current understanding in terms of what we actually perceive to be some of these root causes of the nation's poor health. So what I'd like you to do is, using the QR code that's available here, I'd like you to submit your responses to the following two questions. Firstly, why do you think population health is deteriorating? Why have we noticed this to such a great extent in the last decade? And pitched in a different way, what do you actually consider to be the key drivers to some of these trends? Yeah, so there's lots of responses coming in here, and I think the vast majority of people are hitting the nail right on the head in terms of some of them structural factors around poverty and in-work poverty, and some of the issues around cost of living, and some of the societal kind of issues that we face linked to the social determinants of health, and some people mention around the commercial determinants of health, which we'll go on to talk about in a little bit more detail later. And hopefully what we'll be able to do alongside the resources, the slide resources that we share with delegates who join us today, we should also be able to share some of the responses as well that we have here in this particular interactive activity. Okay, so we'll just give it a couple more seconds to see a few more responses coming in. I can see that there's a couple of participants typing. So once we've got their responses, we'll go straight back into the slides. But that's excellent to see the really good understanding. Okay. So then let's let's set the scene for some of the information that we're going to discuss in the latter parts of the section. So I'm going to share with you a confession. I absolutely love cake. It's one of my guilty pleasures. But that's not the only reason why I've shared cake with you here today, because what I'd like you to think of is our economy as a cake. And the reason why I say that is because each year our governments and many other governments in rich nations set the goal of growing the economy by 2%. It's not all that fussed on the quality of the cake, the actual taste, whether we're putting better ingredients in and whether the cake is becoming a much better product. It's not really all that interested either in whether them slices of cake are actually being shared equitably amongst the population. But that's probably a conversation for us for a different day. But as I've mentioned here, by virtue of setting that particular target of growing the economy by 2%, this means that as a nation, we need to be 2% more productive, but it also means that we need to actually boost consumption by 2% to be able to offset that particular supply. But just think about that for a second, because 2% every year, that means that we need to be 10% more productive in 5 years and 20% in a decade's time. But another thing that we need to bear in mind is how growing the economy can actually have implications on population health. And the through line for this talk, which I hope is extremely clear by the end of today's session, is that growing the economy can actually make us sick. Because as a society, but politicians in particular, we obsess about growing the economy, baking a bigger cake, as I've just alluded to there. But really, do we actually consider the societal costs of doing so? The pursuit of economic growth in many respects has become a much higher priority than protecting and improving the health of all. Because a question I'm going to put forward here is, what if the economy grows because more people are consuming more ultra-processed, unhealthy food more often, resulting in higher rates of obesity? What if, for example, more people are buying larger cars, driving them more often, contribute not just to physical inactivity levels going up, but air pollution going up, more congestion on the roads, more deaths on our roads? What if, for example, the economy grows if more people are suffering psychologically and restoring to alcohol or taking their own lives? The message here is, what if the economy grows but society gets sicker? And a second point to this, as I alluded to before, is the fact that we very rarely give discussion or thought to how that growth is achieved. And as I mentioned before, for the economy to grow, this means that productivity levels need to rise, and so do consumption levels. But this means the goods have to be manufactured faster. This means services need to be delivered faster. This means that the goods and services have to be consumed more often. But what this actually means is, which we very rarely consider, is this means that workers have to work faster or they have to work for longer. And they don't have to do this just because they need to boost levels of productivity. They need to do this to earn the money to meet their ever-rising consumption patterns. So essentially what people need to do is, they need to live their lives faster, no matter what the cost is to their own health or the wider environment. And for a lot of people, not all people, but a lot of people, one of the easiest ways to feel less anxious and less stressed is to actually slow down. But slowing down could be seen as a cancer to capitalism. I was sat there in my kitchen a few weeks ago now, and I was thinking of what sort of examples that I could actually use for today's talk. And I was thinking of my slides a bit. I was just flicking through the Guardian news headlines at the time, and I come across a few cracking headlines, and I thought, yeah, these are great to illustrate this very point. And the first was around car sales, and the second was around growth in sales for the bakery chain Greggs, which is famous for its pasties and its sausage rolls. And there's countless examples that I could draw upon if I wanted to, and I'm sure that many people around the call today could provide equally as good examples. But the point is, we currently applaud growth, even if it has social costs, and this is one of the core messages that I want to get across in today's talk. Another point is, which we very rarely consider, is the fact that our economy could be seen as a rail network. And it can be seen as a rail network because it's man-made, which means it can change. You know, it's amenable to change. It's designed to take us places, and in many respects, it's pushing the vast majority of society to pursue money and wealth rather than health and well-being. And as we've just discussed, in order to achieve that growth, what it needs productivity and it needs consumption. It needs to be doing things faster, and it requires people to continue to put their hands in the pocket. And what I'll argue here today is that many of the health-related challenges that we face are driven by these two structural factors. If we take the obesity challenge for an example, which we'll discuss in a bit more detail shortly, the attraction of doing things faster encourages people to travel faster. It favours driving over walking, buying convenience foods instead of cooking foods from scratch. And this ties in very well with the consumption factor. And as I've just mentioned, the more we work, the more we have to pay others to do the things that we sacrifice through overwork, outsourcing activities such as food preparation. There's even a market now for dog walking. You know, people outsource their dog walking activities. So this also fits into our focus on treatment over prevention, which we'll focus on shortly. The fact is, there's markets now for appetite suppressant drugs, which we'll have seen in the media. There's been a big media attention on these things in recent times with the introduction of drugs by Wegovy. And this fits perfectly with the consumption and treatment narrative. I often tend to watch Question Time on most weeks, and I sit there and all of the issues that they tend to talk about will be systemic in nature. There'll be, you know, societal causes. And I'm always hopeful, you know, I remain optimistic that one day one of the panel members will actually say, listen, this is how it is. All economic approaches have value systems. And when the goal is to grow the economy at all costs, this means that wealth is prioritised over health. And to achieve growth, what needs to happen is you need to value productivity, speed, convenience, competition, individualism, consumption. These have to be applauded, they have to be strongly encouraged. And what does this mean? Well, it means that this shapes the social norms and the behaviour of the vast majority of society, because the reality is we are social beings, and as humans we like to fit in. And not only do humans want to feel accepted, but they also want to gain status, and the way of gaining status is displaying the symbols and the indicators of success. But that's not all, because these economic approaches that we're talking about here influence our lives in many other different ways, because they influence and they shape the policies, they influence and shape policies around taxes, they influence policies around welfare spending, and more importantly, they influence the policies around labour market regulations, in particular things to do with wages, to do with the nature of jobs, and to do with working conditions, how much protection workers have. And collectively, these factors shape health. They have a profound effect on health. One of the things that we often hear is that we just need to grow the economy. It'll solve all our particular problems. But successive governments have promised us this for many, many years. Keep working harder. One day we'll pay for the public services that we need. We'll achieve economic security. We all will. We'll grow the economy, and this wealth will trickle down. We'll even have more leisure time, was the kind of the thought many, many years ago. But actually, that extra time to pursue our hobbies and connect with our loved ones hasn't really materialised. Will this day ever arrive? Well, my argument is, well, no, it won't, certainly not under the current system, because having people work ever longer hours on behalf of the system is very much part of the plan. It's very much part of the plan, because the economy, as we can see here on the image, I've only dated back the last decade. But, you know, you could go further back over many decades. The economy's continued to grow variably over recent decades. But at the same time, these societal issues have arisen. And despite the fact that the vast majority of people in absolute terms have become wealthier, they've had more money, bigger houses, bigger cars, more luxurious cars, more material possessions. If you look at the data, it suggests that on average, the vast majority of people are no more content now than what their ancestors were. And there's a really good book by Richard Layard called Happiness: Lessons from a New Science, which he talks about this particular paradox. And one of the kind of explanations for this paradox is the fact that the reality is our perceptions are relative. And they call this the contrast effect, which has been covered by Cialdini's work. And you know, we're heavily influenced by what other people have and what us ourselves have been used to having, which is called habituation. And they're the two factors that have kind of been used as explanations to describe why economic growth and absolute gains in kind of income and so on over a period of time hasn't necessarily resulted in significant changes in things such as life satisfaction and contentment and so on. Back on to our main focus here, let's think about the evidence for a second, because strong evidence shows that the nation's health is suffering. If we think about the work of Michael Marmot, he spent his whole life conducting rigorous research, the kind of research that all academics aspire to undertake, publishing in top journals such as the BMJ, and highlighting injustices of health inequalities. And his latest work, as part of his role at the Institute of Health Equity, has shown that life expectancy is stalled, and it's gone backwards in some parts of our country, the most deprived parts of the country. But at the same time, some of the work that's been done by the British Medical Association, in the report that they published, The Country is Getting Sicker, where they spoke to a range of different doctors and physicians and so on, and got their perceptions on why the nation's health is deteriorating. And they talked about things such as rising in work poverty, decimated public services, and a broken social safety net. And this corresponds to some of the other evidence that's been published by organisations such as the World Health Organization, alluding to physical inactivity and the necessity of a more preventative approach, as well as some of the other reports by World Obesity and some of the articles that have been published in leading journals like The Lancet, showing how a range of different mental health outcomes and illnesses have been deteriorating over recent times. And what we need to think about is, and what more discussion needs to be centred on, is the fact that where we live and what we earn shape the options that we have available to us to be healthy, including access to affordable, nutritious food and opportunities to be active, something that's very rarely discussed. But people, including politicians, very rarely kind of allude to these particular factors, people's environments that they have available to us, and most of the focus tends to be on individual choices. We think about obesity in particular, the narrative tends to centre around a lack of willpower. The only solution that they put forward is around raising awareness of wholesome foods and better education around lifestyles. But lots of the context missing in this particular story, and this is why we need a new story actually showing that what surrounds us shapes us, and a story that will help to build support for wider changes that will enable people to live healthy lives. The image that I put here kind of alludes to these particular environmental drivers to health. And it's a really, really useful figure to think about how our health is shaped by these wider environments. In his landmark report that he published a decade ago called Fair Society, Healthy Lives, Michael Marmot proposed an evidence-based action plan to tackle health inequalities, and key to his plan at the time was action on the social determinants of health to enable individuals to be able to take control of their lives. And what he said was, and what was core to the report, as was core to many of the reports that have come before it, was he argued that the solution to poor health is to actually prevent it from happening in the first place. It involves moving away from them stick and plaster approaches that we tend to favour, or the government tend to favour, because they fit with short-term electoral cycles and also the profit motive. It involves ditching these approaches and actually investing in long-term approaches that tackle the root cause of poor health, essentially, as that's been highlighted by the many reports by the Health Foundation. It's around providing the building blocks that enable people to achieve good health. And when this happens and you switch the narrative, you change the primary focus from treatment to mostly prevention. There'll be less reliance on things such as behavioural interventions, surgery, medications. These things will always be needed. Well, the fact that 5% of the NHS budget continues to be allocated to preventive activity is testament to the priority that we continue to place as a nation on treatment rather than prevention. And this is something that was highlighted in the NHS's long-term plan, a recognition of a need to switch the direction of focus to prevention. But again, there seems to be limited appetite to switch that in current times. One of the final slides for the start of this scene setting section is around this particular quote, and our focus has to be on improving the opportunities to live well through giving people opportunities to eat well and be active. As I mentioned before, it's wrong that so many people find it hard to afford healthy options. Everyone should have the same chance to be healthy and thrive no matter where they live. And the book by Michael Marmot, The Health Gap, alluded to this particular concept, which I've paraphrased here in the context of obesity. And weight loss programs without changing the environment that promotes excessive energy consumption is very similar to treating people for cholera and then sending them back to the communities with the contaminated water supply. And the first part of our session today, where we focus on the nation's poor health, I've provided this image here. This is one of my favourite images. I can't take credit for the image. This was taken by my wife, and I should credit her for doing that, because she'd probably be quite annoyed. And the reason why I've shared this particular image here is because for anyone that's been there, everything about America is big. It's huge. They do things to excess. And I'm not just talking about the big buildings, the big portions, the big inequalities. I'm also referring to the big people. You know, in terms of some of the prevalence data in the United States, over 2/3 of the country live with overweight or obesity. And it's not just that, because as a nation, it has the biggest economy. It's by far, the wealthiest nation around. But what may come as a surprise to a lot of people is that while it is the richest nation on the planet, it actually scores pretty bad. It scores poorly compared to other wealthy nations, rich nations, when it comes to a range of different social outcomes. And what I'm referring to here is things like life expectancy, morbidity, and other social outcomes such as obesity, mental health, crime, incarceration, drug-related deaths, which are often nowadays referred to death of despair. And it's for this reason that I'd like you to remember that actually rising GDP, as much as we're often told, does not necessarily result in improvements in quality of life and life satisfaction. And if we take the work from, Kate Pickett and Richard Wilkinson as part of their books, The Spirit Level, The Inner Level, that was published over the last decade, what matters is how that wealth is distributed. What matters is how much inequality exists within society. So we focus our attention now then on obesity. In the UK, the public health challenge of obesity is nowhere near as bad as what it is in the United States, but still, almost 2/3 of the population live with overweight. Now, what I want to demonstrate here across these particular slides is how it's an environmental issue. It's down to a structural rather than an individual factor. We're often told that obesity is down to an imbalance between energy intake and energy expenditure, and that's not incorrect. But what it is, it's a shallow explanation. And I often, as I try and explain to students, to really understand obesity, you have to explore the social reasons that continue to encourage people, around the world to eat too many calories, sit too often, and not move enough. And first, let's actually take a look at some of these trends over time, because people living with obesity are in many respects the tail end of a population's distribution. The proportion of people living with obesity is a function of where the average BMI is for that given population. So if the average BMI of a population is high, then more people are likely to have obesity. If we look at this figure here from the 1950s, the average BMI of the population was around 20, and very few people lived with overweight or obesity at the time. Wind the clock forward 30 years and we go to the 1980s, and what you actually see is there's a change in the distribution over time. 30 years later, the average BMI shifted to the right. It was a lot closer to 25, and many more people, as you can see here from the right-hand side of the graph, were living with obesity. So if we take it to the current day, what we see is the picture is far different than what it was in the 50s and indeed the 1980s. That distribution has changed completely. And the series of graphs illustrate to us how over the past half century, as a society, we have been getting fatter. The mean BMI for society has pushed in the right in the right direction. What these images convey to us is that to actually understand the real determinants of obesity prevalence, what you have to do is you have to study the characteristics of populations rather than the characteristics of individuals. That's core to it, characteristics of populations. And the appropriate question to ask is, why do some countries have higher rates of obesity compared to others, rather than why is this person living with obesity? So the take-home message, essentially, what I'm trying to get across here, is the way in which the whole population BMI distribution is either shifted up or shifted down in different countries reflects the differences in a country's way of life. It reflects how the environment's different, and it reflects how them social norms are different in different countries. So moving on to our next interactive task then. So for our next task, what I'd like you to consider is the 5-a-day government-led programme, the goal of which is to increase fruit and vegetable consumption at the population level. And what I'd like you to do is to jot down the limitations of an intervention like this, considering things such as what factors actually drive our energy intake, what sort of influences does an approach like this overlook? So essentially, what else influences our eating behaviour? Okay. So again, what's becoming very, very prevalent there is things to do with the financial and the economic factors and influences, things to do with cost, availability, education, skills, convenience. Okay, yeah, keep them coming in. So we've got 12 participants still typing. Right, so we'll make a note of them and hopefully we can share these responses with everyone after today's session. So it's really good to see that we've got here around cost and availability. You know, these are the consensus across our across the group here today, but still these kind of factors aren't necessarily the kinds of things that tend to get talked about all that much in the public and certainly the political debate, things to do with cost, availability. Tends to focus on raising awareness and education. The vast majority of people, you know, are aware of healthy and unhealthy foods. It's just a lot of people struggle to translate that intention into action, as we'll talk about shortly. Okay, so we'll go back to the slides now. Right, so hopefully that should be shown again. Some of the other things that aren't necessarily discussed in this context, I'm going to focus here on the individual. And what we tend to hear quite a lot. So one of the things that tends to be missing, we tend to often hear around eating a variety of foods, eating a varied and a balanced diet, making sure that the diet's consistent, or perhaps swapping unhealthy snacks and meals for healthy options, which is very closely aligned to that particular intervention that we've just considered. There's very rarely discussion around limiting portion sizes, which again fits with this individual component. There's been a lot of work that's been done around smaller plates and cutlery. The evaluations of these particular programs have resulted in, you know, less energy intake amongst participants as part of these experimental designs. Sticking to a regular meal pattern, you know, the times that people eat, and of course, some people are constrained to be able to do that through shift work and so on. The reality is the brain loves routine, and by virtue of limiting the choices that we have available to us, we limit the paradox of choice. We go off piste a little bit, digress a little bit. There's a really good book by Barry Schwartz called The Paradox of Choice, and he talks about, actually we think about, you know, when we think of freedom and we're thinking about choice, we're often thinking about it in a good sense, and whilst that there are some merits to that, actually when we have too much choice, it paralyzes our kind of thought processes, and it can be a negative, as he talks about in his book. The point I'm trying to raise here is the brain loves routine, and one of the easiest ways to be able to stick to all of these things that we're talking about, eating a healthy, balanced diet. Routine is key, but again, that's very rarely discussed within the particular narrative. Cooking meals at home rather than eating out outside of the home environment. There's been a lot of work that's been done on this in recent years. Healthier, it saves money, it's relaxing, it's a sense of achievement. We'll talk about that later on in terms of the 5 ways to well-being. Of course, this all fits with the consumption aspect that we alluded to at the start of today's session in terms of quick fad diets. There's a huge market, isn't there, to kind of encourage people to, you know, go onto diet programs, and actually what I tend to refer to as the yo-yo approach, too much too soon. Long time ago when I was studying, I used to work in a gym, and at January, just after Christmas, we'd have this huge, I talk about it in the book, we'd have this huge influx of people coming for gym inductions. It would be absolutely rammed in the gym. And often what used to be causing quite a little bit of controversy amongst a lot of people who were signing up to the gym was the fact that they had to have a gym they had to have a gym induction. And they'd say, oh, I've had many of these gym inductions before, do I have to have another one before? Which is testament to the challenge that a lot of people have with maintaining their behaviour change. But the point I'm trying to make here is, for the vast majority of people that come every single day, you know, they'd be really committed in the first week, the second week, and then you wouldn't see them then, because at the same time, for a lot of people, not only are they trying to be more active, but they're trying to eat a more balanced diet. And for a lot of people, they were probably trying to cut down their alcohol units as well after a heavy Christmas period. So they were biting off far too much than they could chew. And what you would often see is that you'd see a big decline in the number of people visiting the gym after probably 8 to 12 weeks. But if I come back to this particular point, there was a really good book that I read recently, Atomic Habits. And one of the points that I took for the book was when he said, in many respects, when we're thinking about behavior change, we're thinking about identity change. You know, we're thinking about living healthily and we're thinking about living more sustainably. And, you know, what we can actually do, what we've got agency over, not everyone, but a lot of people, is our own food environment in our house. And, you know, having a weekly shop plan, not necessarily buying some of these unhealthy foods and cutting that particular temptation. But all these points that we're talking about here relate to the individual. And actually, before we talk about some of the kind of wider environmental factors, what we very rarely think about when we're talking about good quality food and nutritious food is this, because if we think about the Sustainable Development Goals, the 17 that are set out by the United Nations, the discussion around food and healthy diet is often framed in relation to the third of the 17 goals, good health and well-being. So food being significant driver to good health, not just physical health, but also our mental health and our mood. But actually, it's also core to so many of them UN Sustainable Development Goals. If you think about the ones that I've put up here in terms of number 1, 2, and number 12, there's a reason that, you know, the saying living below the breadline exists, because actually, you know, that's what we're talking about when we're talking about poverty. So food, when we're talking about the, you know, food in the context of health, we should actually embrace it in relation to these areas, not just in relation to people being able to achieve good health and kind of reduce the kind of likelihood of illness, but actually thinking about it in a social justice kind of factor in terms of no poverty, no hunger, but also as well thinking about in the concept, thinking about it from a sustainability point of view, responsible consumption and production, because what we choose to consume has varying effects, not just on human health, but on animal health and on environmental impacts. So these factors also need to be part of the discussion. If we think about the work that's done in the report, The Broken Pallet, this is a really good resource, and it's a really good resource for a number of reasons, not just because it clearly illustrates some of them structural drivers to people's food patterns, but it also displays them in a very, very kind of, you know, clear and illustrative way. The report that's published on a yearly basis, I'd strongly recommend. A couple of years ago, I think does an excellent job at providing a clear picture of the food environment. So some of these structural and environmental factors that we've been discussing here, I've highlighted them, the ones in particular on this particular screen, just in the orange borders. So it talks about the reality that the vast majority of advertising that's spent is, you know, it's on unhealthy products. 2%, 2.5% of the advertising relates to fruit and vegetables. If we think about cost, that was the core message that came out of our discussion there before. Healthy foods are nearly 3 times as expensive as unhealthy foods. I used to say in one of the lectures that I gave at one of the universities around, you know, we could walk into one of the supermarkets now and you might want to buy a pizza, you could buy a pizza for £1. But if I wanted to buy a pack of Pink Lady apples, I appreciate that they are like the creme de la creme of apples, but that's probably 3 times the price, you know. So I think that there needs to be a huge shift in the kind of parity between the costs of food. But also as well, let's not forget, again, it was a core point that was raised in our discussion task around availability. There's been a lot of work that's been done by the University of Cambridge where they've looked at the prevalence of fast food outlets right across the country, and they've looked to see where they cluster. And it'll be no surprise that a lot of these outlets cluster in our most deprived communities. They also cluster on the route to to a lot of schools. You know, even though in recent years there's been a drive towards trying to prevent some of these particular outlets being built, it hasn't always been actioned. And some of the work that I've done around promoting active transport to school, you know, we have these objectives. I suppose we could go off and digress about health and all policies. Perhaps we might have time to talk about that later. But we encourage young people to commute actively to school, but at the same time, a lot of these messages around, you know, the advertising of unhealthy food, the accessibility of sweetened beverages and unhealthy foods on the way to the, you know, between home and the school commute. So it's kind of, we don't have a situation where all our objectives are going in the one direction, and that one direction being health. And I think that's one of the main issues why we make very little progress in these particular areas. And the last point that I wanted to mention here was around the prevalence of overweight and obesity. And, you know, there's a huge disparity based on household income and based on geographical location. There's a strong social gradient to childhood obesity. In the more deprived the area, the much higher concentration there is of child obesity. And that often links to some of them structural factors that we've alluded to today in terms of income, but also in terms of accessibility and availability of healthy food. One of the points that I wanted to mention here as well relates to the strong evidence showing the adverse effect of ultra-processed foods and sweetened beverages that they have on health. And there's been quite a few books that's been done. But if we think about the strong evidence in this area from the top journals like the British Medical Journal, this was a paper that was published recently, and much of the evidence has tended to pertain to cardiometabolic health. It's related to physical health, you know, impact on things such as diabetes and heart health. But what's often not discussed is the adverse effect that can have on people's psychological health, on their mood. And these harms were highlighted in this recent meta-analysis that was published in the BMJ. And there'll be a link to this particular paper in the slides that are shared with you after today's session. But despite this particular evidence, this is just one of a number of particular articles that have come out in recent times. The focus refrains from tackling the supply side of the equation. Ministers often talk about, we'll listen to the evidence, you know, we'll take on board the evidence, and that will guide our decision making. But in this particular area, there doesn't need to be any more research done. The evidence base in this area is huge. You know, instead, there needs to be greater focus and emphasis on cutting the kind of the demand. You know, or that's what the focus tends to be on. It tends to be on cutting the demand, encouraging people to make healthy choices. We're actually focusing on the supply side of the equation. And this figure that I've shared with you here today is from the previous Chief Medical Officer, Dame Sally Davies, and the title of the report was Time to Solve Childhood Obesity. And it sets out some of the actions needed to improve the food environment, to improve an access to healthy foods and tackling the commercial determinants of health, where there's a strong evidence base around now, certainly some of the reports that's been published in the Lancet, around tackling marketing and advertising of junk food. And there's lots of things, as this particular report goes into great depth, there's lots of things that governments can actually do to improve diet quality at the population level. And these are very broad and varied, and they include things such as the costs of food production, manufacturing. They also talk a little bit about food distribution and food taxes and pricing policies like we've just mentioned before, but also around food subsidies. But they also relate to wage structures and policies. And this was something that was mentioned in the interactive task that we had before around price and around cost. And what governments can do, as well as changing the food environment and shaping the food environment to make sure that the default option for many people is the healthy option. You can also change and make changes around wage structures and policies that influence household income. So the things that influence the social and the economic resources that people have available to them to be able to purchase healthy food. Now that we're focused on obesity, I'd like to focus our attention as well on one of our other public health challenges, which relates to physical activity. It's one of the other contributing factors to energy balance, and this is an excellent figure. There'll be a link to this particular figure in the notes section of the slides. And if we look at the top left of this figure, this is what's called the SLOT model. And the SLOT model relates to sleep, leisure, occupation, transport, and health. And essentially, these are the different domains of our everyday lives in which we can expend energy. But here's the thing, as I wrote in a recent perspective piece that was published in Leisure Sciences, the goal of economic growth and the pursuit of productivity and consumption to achieve it has had drastic changes in the way in which we expend our energy. And I argue that every effort has been made and will continue to be made to bring to market novel and new technologies and machines and electronic devices to save time and boost productivity. And what this does is this reduces what I refer to here as non-exercise activity levels. So them kind of incidental modes of activity, the sort of physical activities that contribute most to our overall daily energy expenditure. And it's these very activities that are the easiest to incorporate into our everyday life and maintain in the long run. So if I focus in and give some explicit examples, if we think about occupational activity, status, social status, and higher salaries are assigned to jobs that are cognitively rather than physically demanding. That's a point that's very rarely, discussed when we're thinking about, differences in energy expenditure across occupations. One of the big drivers for people's energy expenditure is their occupation, not just in terms of how much movement they do in their job, but also the time that they have available outside of working hours. Physically demanding jobs do exist in our nation, in rich nations, but they're disproportionately represented by those from lower social class. And even in these sectors, physical labour has been replaced by machinery and will likely be replaced by machinery in the years to come. And there's also, as well, what we need to remember, there's been a gradual shift to home working. And whilst this can have a positive influence on physical activity for some people, perhaps by providing the opportunity to engage in leisure activity, from a transportational perspective, it perhaps may also cut down on the levels of physical activity in terms of walking and cycling to and from work. Another thing to bear in mind, non-exercise activity, which we could consider movement that's beyond sleeping, that's beyond eating and digestion of food, and beyond things such as sport and structured forms of activity. These are the types of activities that are undertaken outside of paid work, such as walking and physical labour, doing the garden and so on. They don't contribute much to the economy. Yeah, and also, as I argue in the article, is that they're not status symbols or markers of success anymore in the society that we have. We haven't got time to go into too much detail about this today because I'm conscious of time. But actually, there was a necessity to be physically active, in centuries gone by. But as I argue in the book and also some of these articles that I've written recently, from an economic and status enhancing perspective, it's more lucrative if people drive to places than walk to them, have a labour-intensive job, outsource their housework, gardening and dog walking to someone else, and in the leisure time that they do have available to them, partake in commodified forms of leisure, and that could either be as a spectator or as a participant. One of the other points that I want to raise is that when people have been to work all day and perhaps feel physically, or in many respects, because we have a knowledge economy, psychologically and mentally drained, The last thing on the mind is to get some additional exercise in. And that's because if we think about the work of Susan Mickey and behaviour change and some of the work that she's done around, the COM-D model, motivation, capability, and opportunity, this point's very pertinent to the discussion because leisure time activity, according to a lot of the systematic reviews in this area, it may be, the most beneficial kind of activity that we can do to benefit our health. But the reality is, compared to other types of activity, there's financial, time and geographical barriers to participation. And this is something that was discussed in the book by Dan Lieberman, and there'll be a link to this book in the slides. The title of the book's called Exercise. The reality is, leisure time activity isn't the type of activity that we've evolved to do. We evolved to engage in activities that are incidental in nature, the types of activities such as walking from A to B, rather than that structured form of activity that we usually do at the gym. As much as I'm, a big advocate of physical activity, one of the other things that we need to bear in mind in this particular discussion, another very, very good figure that illustrates the change in nature of not just the way in which people spend time, but also their physical activity. Some of these structural factors and societal changes are at the top of the figure, but I'd like us to zone in the middle section here where we've got our blue kind of box around the modern Western lifestyle point. The reason why physical activity levels have declined at the population levels because our way of life has changed, and it's changed dramatically. As I mentioned there before, traditionally we had labour-intensive jobs and we travelled around, which left very little time available to engage in leisure time activity. But now if we think about the jobs that people do, not all, but a lot of people in high-income countries, including my own job, they're highly sedentary, and people live at a great distance from work compared to what they used to do. And not just a great distance from work, but for some people, a great distance from some of them essential services, the types of services that they need to be able to meet their daily needs. And what this means is, the point I'm trying to get across is, they live door-to-door lives. And that has consequences, it has costs. It doesn't just have costs in terms of the energy expenditure that we're talking about, but you could also argue that it has an adverse effect on communities as well, because perhaps the vast majority of people lead door-to-door lives. There's limited interaction that you see between people in communities, and this is something that was picked up upon in a book called Bowling Alone. And it talks about, the changing nature of communities and so on, not just in the context of physical activity. It was more in the context of people engaging in civic types of activities in their community. But on average, we have more leisure time, but this time tends to be utilised for sedentary pursuits, and that's what we see here. So it's a volitional effort that's required to embed exercise into our schedules, and this one is one of the main reasons why a lot of people struggle to maintain a physically active lifestyle beyond their work. This cute dog that's here today, I was talking about this to a couple of colleagues just before today's session. This isn't my dog on the right hand side, this is my sister's dog. So this dog's called Dolly, and I'm going to be biased, she really is a special dog, but I haven't shared Dolly with you today just to talk about their aesthetics. I've talked about it being that the take-home message from this particular slide is that we should all walk our dog, even if we don't have one, because walking has so many health benefits and societal benefits. Walking is by far the easiest and most convenient form of activity that we can incorporate into our everyday lives, because not only does it benefit our health in terms of the physical benefits, but it also benefits it psychologically, cognitively, and emotionally as well. But the truth of the matter is, as I allude to in my book, is that monetarily, it's free to undertake. Walking's free to undertake, it just requires our time. So from an economic perspective, certainly where business is concerned, it's far more lucrative if people drive to places than walk to them. And if we come back to the energy expenditure equation, from an energy balance perspective, walking is key as it contributes to what we refer to here as non-exercise activity thermogenesis, which plays a key role in overall energy expenditure. There's a range of evidence that's available when it comes to behaviour change. I mentioned before in terms of Susan Mickey and some of the work that she's been done. And she talks about, and her colleagues talk about, some of the effective ways that behaviour change has occurred in terms of things such as physical activity, smoking cessation, and so on. They talk about the benefits of setting goals, setting a long-term goal, but then having graded task setting. So you might set yourself the 10,000 step goal, but actually you realise that that's some way away. So the initial target is 5,000 steps. And what's core to is that self-monitor and making sure that you're reviewing your progress towards them goals. Also, as well, they talk about barrier identification and planning. If-then strategies, these are often called. So perhaps I may have the objective of running after work or running twice a week, but actually I come home from work and I realised, you know what, that was a really tough day in work today. So if this happens, rather than going for a 30-minute walk, a 30-minute run, I'm just going to go for a short walk around the park. And then also, they talk about contingent reward. I mentioned earlier on around the fact that I have a love of cake. And it's about making sure that when we're setting ourselves these goals and we're monitoring ourselves on these goals and we're working towards them and we achieve them, we give ourselves some sort of reward to kind of keep our motivation up. So in this particular example, going for a walk and then having, you know, coffee and cake at the end of the walk. But again, all these things that I'm talking about here are all well and good when we're thinking about the individual. But when our ultimate goal is actually to support the population and support everyone to be able to get more active, we actually need to take a different approach. We actually need to think a little bit differently. And whilst there's a lot of merit in a lot of these particular approaches, and whilst the evidence suggests that these do actually work, when we're thinking about physical activity at the population level, we need to think more about getting the nation moving. We need to think about environments and neighbourhoods and how we can shape these environments and neighbourhoods to support people to walk and cycle. This image here that I've shared with you today was when I visited Copenhagen a few years ago, which was, you know, such a contrast in terms of how far ahead they are when it comes to support and active travel. And the reason that more people cycle in places like Copenhagen, Denmark, and also many of the other kind of Scandinavian countries and as well, you know, the Dutch cities, isn't because these have the cycling gene. You know, it's not down to some sort of differences in biology. It's because cycling's prioritised over cars and it enables people to get from A to B, not just easily, but also at a quicker rate than what the car would. If you're fortunate enough to go to Copenhagen, some of these other Scandinavian countries, you'll see the cycling's prioritised, and cyclists have separate lanes compared to cars, as you can see here. They have separate traffic lights, and when these traffic lights turn green, the cars need to slow down, they need to stop, and they need to give priority to these cyclists. And what I'm trying to get across here is, if you go to Copenhagen, some of these other countries, it feels safer and it feels more enjoyable. You know, even for the most committed and motivated and encouraging of active travellers, shall we say, including arguably myself, you know, you'd be truthful in actually saying that cycling in many of our cities is, you know, there is that sense of being unsafe. So that the point here is actually That's why it's so difficult to encourage a lot more people, certainly people who may not necessarily feel predisposed to engage in them types of activities, to walk more or cycle more. And as I mentioned before, the same goes for the Dutch cities such as Amsterdam, which is another fantastic city when it comes to supporting active travel. Following the Stop the Child Murder campaign that took place many, many decades ago, on the back of a number of children, many children being killed on the roads, there was huge activism that took place across the city and the nation and so on. And this led to changes in transport policy. It transformed, the environment in which people navigated, and it led to better infrastructure, and this improved infrastructure changed social norms. And that's the message here. If you change the environment, you've got strong potential to change social norms. And by virtue of doing that, coupled together, you have a stronger ability then to be able to change behaviour. Our streets essentially need to be designed not for cars, but for people. We often forget that streets are for everyone, but actually over time, we've got this kind of feeling that actually streets are for cars, but they're not, the public spaces. And governments need to ensure that everyone has the opportunity to be active, play, connect, and feel safe in their community. So if you're interested in some of these particular points that we've talked about here in terms of physical activity, some of the structural drivers to physical inactivity, there's a number of different resources here, including the book by Daniel Lieberman, which was published a couple of years ago, which you'll be able to access in your own time. So we're going to now move on to the next section. Now that we've covered obesity and we've covered physical inactivity, we're going to focus now on mental health and well-being. And this is an area that, I feel very, very strongly and passionately about. And underpinning this section of our particular session today is this particular quote that I've included here. This is something that I thought I'd include just to underpin this section of today's talk. And it's capitalism is to the mind. I should say capitalism in its current form, because all versions of capitalism aren't necessarily bad. But the current version of capitalism that we have, I argue here, is to the mind what rust is to iron. It has a corrosive effect and it degrades slowly. Before we actually think about some of the mechanisms that's driving poor mental health and challenging well-being, I think it's really important for us to actually consider some of the evidence pertaining to whether we do actually.
Rob, we lost you. I think you've gone on mute.
Right, I'm back now. I think me mute just came on automatically.
Yes, you're back.
You hear me okay?
Yes, yeah, all good. Thank you.
Okay, I'll just repeat what I said before then. So before we go on to think about the mechanisms, I think it's really important for us to actually think about some of the evidence pertaining to whether we actually do have a problem. So I'm drawing here on some of the data from the NHS and some of the work that's been published in the BMJ, which allude to some of these particular figures. A couple of years ago now, so the data, I think this is the most recent evidence, from 2022 and 2023, highlighted how there was 86 million antidepressants prescribed, so roughly around those 8.6 million identified patients. They say that this is roughly 20% of all adults. When you compare that with previous years, the previous year, that was a 2% increase. That equates to roughly about 200,000 individuals. In terms of it from a looking back over time, this is a doubling over the past decade. So in the last 10 years, these figures have doubled. At the turn of 2011, it was roughly around about 47 million, and now it's around about 86 million. And what I'm going to flag up here is there was a really good documentary series that came on to BBC. I'll just talk about this briefly. A few years ago now, I was actually really surprised when it came out, because it was on the BBC, and very rare for them to be extremely radical. And this particular documentary series was called $1 Billion Deals and How They Changed the World. And I'm sure that you'll probably still be able to get access maybe on iPlayer, or if not, just type it into Google. $1 Billion Deals That Changed the World. And it was the person who presented the documentary, Jacques Peretti, his name is. And anyway, the point of this is 3 particular episodes were published. One was on work, one was on money, and the other one was on health. And I seen this really at the time as like the golden triangle, because once people have stable work and you have stable income, there's a good chance they're in a better position then to be able to maintain a decent standard of living and maintain good health. And what he talked about in this particular documentary, which was actually, it was illuminating really, he talks about how the deals that have been undertaken, not just in pharmaceutical industry, but also between medical industries and so on, have transformed not just how we talk about mental health, but also how we treat mental health. And I talk about this in a little bit more detail in my book. But more recently, one of the books that came out, which was an excellent read, was by James Davies, and it's called How Modern Capitalism Created Our Mental Health Crises. Really good book it is. And what he talks about in this, he argues that despite the prevalence of prescription drug use over time, given the fact that it's risen over the years, so too has the number and the severity of cases. So it contends in many respects along the same lines as what the discussion's been today. For most, it's the understandable collateral damage to the wider societal problems that people face. There we go. Okay, so when we think about mental health then very briefly, we often think about it as the absence of the negative, okay? The absence of the negative, the absence of mental illness. But actually, there's been a substantial amount of work and research that's been done, certainly in recent decades, certainly in the field of positive psychology, around the really important presence of the positive too, okay? So not just thinking about it in terms of the absence of the negative, but also thinking about it, the presence of the positive. And what I want to try and argue here and contend here is that actually the capitalism in its current format, it actually challenges both. And there's an extensive literature, as I mentioned before, from positive psychology, including the work of Martin Seligman that we'll talk about shortly, and his PERMA model, positive emotion, engagement, relationships, meaning and achievement, as well as a whole host of different positive psychology theories, self-determination theory, the work Carol Riff, and so on around self-acceptance and personal growth and so on. And what I contend is, not only does capitalism, as we'll talk in a few slides' time, not only does it kind of add insecurity and precarity into people's lives, and it's anxious and promotes fear and so on, but it also challenges some of them kind of factors that are often discussed in the positive psychology literature around intrinsic goals, self-acceptance, personal growth. If we think about the work of Robert Sapolsky, who's done a substantial amount of work in this particular area in terms of chronic stress, and we'll talk about Sapolsky's work in the latter part of today's session. Strongly encourage you, if you're interested in this area, not only read some of Sapolsky's work, but he's an excellent public speaker as well. He does some great lectures that are available online. What Sapolsky talks about is the building blocks to chronic stress. And briefly, he talks about these 4 points here. He talks about a lack of sense of control and a lack of sense of security. He talks about a lack of predictability, a lack of frustration outlets. We're talking here, there's a broad range of them, and these will be very different for every individual, but frustration outlets could be very, very similar to a lack of social support. Frustration outlets could also be having hobbies, having interests, and so on. Point is, when we often see high rates of poor mental health in areas of disadvantage. You know, this is down to the fact that the social disadvantage is linked to a disproportionate share of not just physical stresses, some of them things that we talked about before, such as the social determinant of stress and poor health, but also the psychosocial stresses as well. So in what ways does it actually challenge mental health? Well, what I contend here is, the reality is the system that we've actually got is deliberately destructive. And it has to be deliberately destructive because, as we mentioned before, the points around productivity and consumption, it has to create new tastes and new desires in order to boost consumption, spur on productivity and production, and achieve growth. But as we've already discussed, this has social costs, and we see them social costs in the technological and the structural employment, as well as the precarious working conditions, which we know and there's strong evidence showing that harm individuals' psychological security. So that's the first point. We also could link in here some of the work that's been done by economic historians. So I allude here to Simon Streeter, and he developed and talked about the 4Ds. And what he meant by the 4Ds was disruption, deprivation, disease, and death. And a lot of his writing has referred to and has been contextualized within the Victorian era, and how the rapid economic growth during that particular period led to more deprivation, it led to more diseases, led to more deaths. These particular diseases and deaths were as a consequence of infectious diseases. Okay, and at the time he speaks about how government intervention, state intervention was actually needed to mitigate against not just the insecurity that people experienced in their lives, but also the negative effect it had on people's health. He argues that actually if the state don't intervene in this particular scenario, you see an increase in deprivation, an increase in diseases, and an increase in death rates. And there's striking parallels with the present day. Whilst back then the focus was on infectious diseases, now we're thinking more about non-communicable diseases. But it also needs productivity, as we mentioned before. And as I talked about in the opening couple of slides, in order to achieve that productivity, we need to be speeding up all aspects of society. It requires faster manufacturing of goods, more services being delivered faster. Essentially, it's encouraging people to live their lives faster. And of course, this can be anxiety-inducing for a lot of people, not just in terms of being overworked and exhausted, but also there's a close relationship with underwork, which, as we mentioned, we'll mention shortly, can actually be, you know, a key source of chronic stress for a lot of people. It's also linked to consumption. And we mentioned earlier that the ideology of treating particular illnesses is very, very different to preventing them in the first place. But this automatically kind of aligns very, very closely with the profit motive around treatment over prevention. A point that I talk about in the book as well links to status. And actually, the system encourages status anxiety, you know, and the contrast effect, and more status over time and identity has been linked and attached to what people have, you know, what their kind of material possessions are. People are able to consume not just for comfort, but also to raise their status. And we see this in widespread sales rates and debt and waste that we see across society. And one of the education forces used to boost consumer demand, advertising. And what we've seen is in recent years and recent decades is it's actually become economically lucrative to prey on people's emotions and prey on people's fears and insecurities and so on, because arguably when people are, you know, content with what they have and who they are, there's less likely that they'd be inclined to consume to achieve status. One of the other points that I talk about as well is this point on fear. And it's another thief of joy in the fact that we're constantly bombarded with negative news. We receive it every single day. Whereas the talk about here, in 2016, 2017, roughly 56 million people died on the planet, and that's roughly consistent across most years according to the data. But what you may be surprised to hear is only 1% of them deaths were actually attributed to war, terrorism, and natural disaster. And, you know, them deaths are really, really bad. All deaths are bad, but actually for the vast majority of the population, that would be a surprise to them. You know, over 70% of deaths are actually down to non-communicable diseases, and there's lots of evidence showing that people are more likely to take their own life than actually be killed by someone else in society. And one of the other points is around competition and self-interest and what impact that this has on society. Very briefly, you know, when you have a huge promotion of competition and self-interest and everyone out for themselves, it divides society along class lines. Not only does it divide them in terms of workers versus bosses, in terms of competition between wages, but it also instills competition between companies around profit margins, but also as well, something that we very rarely consider, is the competition between workers, you know, pitting against each other for jobs and also scarce resources. And collectively, you could argue that this brings it all together in terms of a widespread fear, panic, and anxiety in these particular respects. And it also challenges the universal psychological needs, which we know from the work of Decky and Ryan around autonomy, competence, and relatedness, which we haven't got too much time to talk about in today's session, but briefly, we'll think about them here in terms of one of the other particular outcomes, because what the system actually does is it challenges psychological well-being by devaluing them non-economic activities which do benefit our health and well-being. The two images here that I've shared relate to the work that's been done by the New Economics Foundation and also from the work of Martin Seligman. And what the work of Tim Kasser, who's a researcher from the United States, has evidenced, he's dedicated an awful lot of his work and career to doing research in this area. He's shown that the materialistic value system that dominates life in many rich nations crowds out the meaningful values aligned to self-acceptance and personal growth, them very things that I mentioned briefly before that are core to psychological well-being, which the pursuit of these non-economic activities support. The activities that are promoted by the NHS, such as the 5 ways to well-being, connect and being active, taking notice, keep learning and giving, but also the points that are raised as part of the well-being theory that Seligman came up with around positive emotion, engagement, relationships, meaning and achievement. When people choose and prioritize extrinsic goals, the type of goals and the type of values that are promoted by the system, such as power, status, wealth, and so on, you can argue that this crowds out the pursuit of them intrinsic goals. When people choose to work harder for longer, and it provides less time to be autonomous, to engage in the activities where you can experience a sense of competence and to also develop our relations as well. And when I mentioned there before about being autonomous, this is one of the points that was mentioned in the work done by Kate Soper. She's recently published a book around growth and degrowth and so on. And she talks about autonomy and the fact that actually the system that we have is that by virtue of people prioritising work and working more to earn more money, it actually has a consequence in the fact that we have to then outsource all them types of activities that often, in many respects, are quite health enhancing. So, in a nutshell, you know, what's the answer? Well, you know, there isn't necessarily a silver bullet, but a question that we have to ask ourselves is what can be done and what can be done to support young people. I think that that's key. What can be done to support young people? And the people who kind of don't really know any different because they've been brought up in a society all their life. where this is just a kind of consistent narrative. How can we prepare young people to manage, in many respects, a VUCA world, a world that's volatile, uncertain, complex, and ambiguous? If we think about the work of Professor John McMurtry, who's a philosopher, one of his famous quotes is this: knowledge always wins in the end, but not unless and until that it's known. And it's about us sharing the importance and advocating the value of intrinsic values, because not only do they enhance human well-being, but they also enhance planetary well-being. The core to the United Nations Sustainable Development Goals, they are right at the heart of them. The importance of intrinsic goals and social value and so on. At the moment, though, there's a war of values, I argue, whereby private money is valued. It's valued much more than, public money, and also human and nature and societal value. We need to open young people's eyes to these particular matters, and we need to provide an alternative narrative to the narrative that they often receive. And it's also about sharing with them some of them points that I alluded to in the last couple of slides around the current system being set up to actually make people feel inferior and actually prey on people's insecurities and promote fears, and actually alluding to the fact of what can actually be done to kind of, offset some of this fear and insecurity that often comes our way. I mentioned before how it's become very profitable to actually play on people's insecurities and so on, and how the advertising industry is set up in order to be able to fill this particular kind of challenge. Final section then in terms of the health inequalities before we move on to talk about the workplace. This particular image that I've shared with you today is a painting of a wall in South Liverpool. It's an area that I used to walk quite frequently when I lived in South Liverpool. And the reason why I've shared it here is because for me, not only does it symbolise various kinds of social injustice, I think it conveys really well the collateral damage of our current economic system and the government policies in particular, a concept that I've called here failure demand and has been used previously in different contexts. And what I contend here is that over the past decade, there's been a significant rise in economic insecurity. And this was something that was mentioned at the start of our session when we had our interactive task, due to insecure work, which has resulted in far too many people leading insecure lives. What is more, public services have also been decimated, they've been eroded. And this is an important point because it's the most vulnerable in society who depend on them. And if we look at the evidence, austerity policies, there's been many articles that have come out recently that has demonstrated how austerity policies don't just create living and working conditions that have negative impacts on health, they also kill. And there's lots of evidence in this particular area. To survive, one of the analogies I want to provide before we move on to talk about some more of the evidence is I had a conversation with a friend of mine the other day on the telephone. I was explaining to him around prevention and so on. And I was saying, to survive and thrive, the human body and the mind, it needs nourishing, just like any plant does. We nourish our plants. And say you pot a plant and we were to restrict its water supply, feed it poor quality soil, and not expose it to any sunlight, would actually be a fool to think that it was ever going to not only survive, but indeed thrive. And there's striking parallels with humans here. Like plants, humans are heavily dependent on social medicine, good conditions of life, adequate shelter, and good quality food. But to meet these particular needs, humans need income to be able to keep pace with their living costs. We think about the evidence then, the good work that's been done by Sir Michael Marmot and the Institute of Health Equity has identified how, population health's been deteriorating. A series of reports that's been published in the last couple of years, but more importantly, at the start of the year, found that over the past decade, health inequalities led to around 1 million excess deaths in England. the health inequalities we experience in our country are preventable, but they exist and continue to exist on a grand scale. If we think about Liverpool, the place I was born and raised, a baby born in wealthy Kensington can expect to live over 10 years longer and nearly 10 years more in good health than a baby born in relatively deprived Kensington in Liverpool. And the profound health inequalities that have been dating back many, many centuries continue to the present day. You know, but extensive evidence shows the health inequalities, they don't just start early in life, but they're manifested, they evolve by the environments in which young people then grow, they live, they work in their later age. And as we mentioned earlier, in his landmark report published 10 years ago, there was kind of an emphasis on tackling these social determinants, but that evidence that I've just presented there demonstrates how the social determinants have not been tackled during that time. One of my favourite books is called The Ragged Trials of Philanthropists, and it's by the author Robert Tressel. And what Tressel did in this book was he was talking about the degrading health impact of absolute material deprivation, inadequate nutritious food and shelter. And it's something that's been known for centuries, because if you wind the clock back 70 years from when this book was published, it was highlighted in a book by Friedrich Engels called The Condition of the Working Class in England, published in the 1840s. He argued that the living and the working conditions brought on by the capitalist system resulted in health inequalities, and these health inequalities sent the English working class prematurely to the grave. And in this book by Tressel, it's a semi-autobiographical novel. What he talks about in the book, which was written over a century ago, he explains how the poor health of the hero of the book, impoverished painter and decorator Frank Owen, could not be solved by medicine alone. What he actually needed was social medicine. He needed proper conditions of life and proper food. And there's so many parallels to Tressel's work and my own. Not only do the book share the same narrative that capitalism degrades health, but we actually share the same name, because Tressel wasn't his original name. His original name was Noonan, it was Robert Noonan. And it also shares the attachment to the same city, Liverpool. So there's so many different striking parallels to this particular work. And what he was basically highlighting in that particular book was this. He was highlighting back then that the rapid economic growth is disruption, which leads to disadvantage and results in disease and excess deaths. And as there was pointed out in the work of them economic historians they alluded to before, unless that's mitigated through state intervention, you then start to see consequent effects on the health of the population. And this is a really good image. It's a really good article, actually, that was published about a decade ago now. It provides a clear illustration of how some of them structural factors shape the everyday work and lives of people, in terms of how kind of policies shape labour market regulations and shape the welfare state, and how this has effects in terms of the stability or the instability of working conditions, and how this has a knock-on effect, not just in terms of material deprivation and whether people can actually meet their living needs, but also the exposures in the working environment, and how collectively these can either have positive or negative effects on the health and the quality of life of the workers. At the forefront of William Beveridge's mind, the architect of the welfare state, was to actually give people a sense of security. As we've seen in the decades following World War II, the government attempted to provide security for its people and protect it from some of the harms of the capitalist market. So what you see here, there was more of a social democratic form of governance. What they were trying to do was mitigate some of them costs, trying to mitigate things such as individual vulnerability to risk It's trying to mitigate things such as limited provision of public goods and services, but also the externalities of economic activity. And characteristic of this time was the implementation of the welfare state, which we see here, and tackling them 5 giants: want, ignorance, squalor, idleness, and disease, which Beveridge termed. And progress, no doubt, has been made in the 5 giants over this particular period, but still, we still see these prevalent across society in 2024. And the issue is, we very rarely actually think about the implications of chronic stress and toxic stress and the impact that this has, not just directly on the body, but also on the brain, and also the indirect effect that this has on individuals and on their lives. This is the kind of things that have been written about extensively by the work of Robert Sapolsky that I alluded to before. There's clear evidence of not tackling the 5 giants now, because over the past decade, there's been a significant rise in economic insecurity due to insecure work, which has resulted in far too many people living insecure lives. And it's wrong that actually millions of people go to work and remain poor. They tread water every day to survive. It may come as a surprise to a lot of people that actually roughly 70% of working age adults in poverty live in a household where at least one adult is working, according to the work of Joseph Rowntree Foundation. One of the other things we need to think about is millions of young people are actually going without adequate nutritious food. And we know the consequent effect of this. It can actually lead to stunted growth and delayed development. And there's been reports suggesting that there's actually been a rise of Dickensian-like diseases. Whether or not there's been empirical evidence undertaken in this area, it still raises cause for concern. And we often just think about food as, being key to physical and mental development, but it's also a core part of prevention. It's a core part of the disease prevention. And there's been a lot of evidence that's come out in recent years that's looked at differences across countries in terms of the height and weight of young people and development trends, and how the UK scores poorly to some of these other high-income developed nations. As I mentioned before, Beveridge is being challenged now because Beveridge spoke in the 40s about one of the main routes out of poverty is actually through work. But what we actually see now is, as I mentioned before, there's been a huge rise in work poverty. People need work and income to meet their basic needs, but when we actually think about income, we often think about it just in terms of wages. What's their hourly wage? But we often forget that actually this equation revolves around the number of hours that's been worked. And over time, as that was flagged in a book that was published in 2011 by Guy Standing, The Precariat, there's been the jobs that have been surfacing have actually, in many respects, often been low-paid, insecure, casualised work. So lots of people are struggling to get by, struggling each and every day just to be able to meet their particular needs. And as I mentioned, it's been talked about in the book The Precariat, another really good book in this area about the consequent effects of not just insecure work, but toxic workplaces. There's been a book by Jeffrey Pfeffer called Dying for a Paycheck, and we'll talk about some of these issues in the next section of today's talk. But one of the other areas on top of insecurity and insecure work, another reason why we see, a challenged population health is around decimation of public services, and also the kind of the safety net that's in place for the vast majority of society. Local authorities, as many people know, play a vital role in the public's health. They always have done since they came into, since they started. If we think back to the Victorian era, they've always played a key role. And local authority budgets have been slashed by almost 80%, and perhaps some cases a little bit more. As many people on the call today I'll be fully aware, there's many public services that are on the knees. Many councils are going busts, and this is a huge concern, because these are vital mechanisms alongside some of them regulatory policies that I've alluded to, that are able to tame the insecurity and the health effects of capitalism, in its pursuit of economic growth. It can take some of that insecurity out of people's lives, and it can support them. It provides a building block to be able to achieve good health, certainly for the most vulnerable in society. I talked before about some of this evidence, and I'm going to present it briefly here. Strongly encourage you to look at this particular report if you've not had sight of it already. They're talking here about how some of these factors that I've talked about here in the last couple of slides have contributed to poorer population health. Talk about things such as the decimation of public services, in-work poverty, and a broken safety net. And in the decade following Marmot's call to action on the social determinants of health, this report, like many others, evidenced that health inequalities not only widened, but on average population health deteriorated. And for the first time in a century, life expectancy stalled, and as I mentioned earlier, has actually gone backwards. And evidence shows that these austerity policies that the nation's been exposed to, cutting back in public spending, has contributed to hundreds of thousands of excess deaths and many more people dying younger. One of the other analogies I'd like to share with you is that, to set the scene for the failure demand slides that come shortly, is that if we first think of this bucket full of health, as you can see on the slide, the bucket has many, many holes in it, but even if it only had one hole in it, and the health is dripping out the bottom of the hole or out the side of the hole, one of the strategies we could do is just to run around as fast as possible and mop up the floor below, every hour, maybe even squeeze some of the health back into the bucket from the mop. But eventually the health will be lost because we're not addressing the problem at source. Instead, we could actually look ways to prevent the hole and stop the leak from occurring. This leads us in then to the concept of failure demand. And what I mean by this is the process of having to tackle the avoidable social problems that the economic system, and in many respects, the government policies have created. It's been called the failure demand in other contexts before. So the evidence of this vicious cycle can be seen in the disproportionate allocation of funds of treatment services in healthcare and the detriment to preventative services. What I flag up here on the right-hand side of the slide is this. When workers are paid peanuts, when they're paid not enough money to be able to meet their needs, what happens is the government are then obliged to top up worker wages. This happens because, of course, there's a profit motive that's at play, and companies naturally want to increase their profits for shareholders. But when workers are paid poorly and have a toxic and insecure working life, as we've mentioned today, they suffer psychologically. And when they suffer psychologically, they may turn to drugs, prescription drugs, to be able to manage the precarity in their particular lives. But also, in a similar vein, I've talked here in terms of stress and chronic stress and the use of drugs to be able to combat some of that insecurity. But also, we need to think about clinical treatment and behavioural programmes that are used to actually change the lifestyle habits and physiques of those who eat, poor quality food and, have low energy expenditure patterns. And essentially, there's striking parallels between these two particular points. So the overarching narrative of this particular slide and this particular concept is, by virtue of not taking the preventative approaches, what happens is you then have social costs, and then social costs need to then be dealt with public funds to actually rectify that particular cost. So you're actually mopping up the mess in actual fact, the system and the policies that have not necessarily tackled the things that need to be tackled have led to. And the example I can provide here is around this. So by virtue of focusing on growth at all costs, what you see is a key focus on productivity and consumption, as we've mentioned. And some of these harms can be seen in terms of income inequality, productivity and consumption insecurity, as well as loneliness and some of the environmental impacts. And these factors then give rise to things such as widespread poverty, crime, obesity, physical inactivity, mental health, poor air pollution, and so on. These are the knock-on effects. And as I mentioned before, large sums of public funds then need to be used to be able to tackle the collateral damage, some of these things that we've seen here. And then here's the point, there becomes strong justification for more growth then, because there needs to be more growth in order to pay for all these issues that are arising as a consequence of the system. Okay, so I'm briefly now going to talk about some of the examples of inaction and the inaction when it comes to prevention in regards to treatment. So at the heart of decimating public services and population health, as we mentioned before, is cuts to public provision. Youth clubs are a safe space, as many people know, for young people. Not only do they provide a sense of belonging, but they also give young people an opportunity to go somewhere, to meet with friends and so on. But at a time when young people's mental health is at crisis point, these particular services have been curtailed, as evidenced in some of the reports by the YMCA and some of the statistics that have presented here on the screen. Also as well, what's at the heart of cutting down on health inequalities has been Sure Start centres that was introduced by the Labour government. There's been a lot of evidence that's demonstrated the positive effect of these Short Start centres, particularly in making positive strides towards cutting health inequalities. But again, at a time when we know the health inequalities are widening, these particular services have been cut. If we think about physical inactivity, we know, as evidenced by the World Health Organization, that this is not just an issue in the UK, but also in many developed nations. Leisure centres, swimming pools are core to the health and well-being of many communities. You could argue that they should come under public health because they are a huge asset to communities and align with a lot of the policies around getting the nation moving and achieving good health. But they're not part of ring-fence funding. But that's a conversation for a different day. But it's well established that these particular services as well have also been cut despite some of the public health challenges that we face. One of the other areas that we are challenged by is loneliness. And it was very much evidenced in the government's introduction of a loneliness strategy in 2018. And they have a minister for loneliness, which may actually be a surprise to a lot of people. But again, these particular services, even though they don't just provide access to digital resources and online resources, they give people a safe space to actually go and meet others. These particular services have been cut in recent years. When it comes to regulation, there's also been an inaction in terms of providing the regulation needed to support people to achieve good health. There's been an extensive amount of evidence in relation to food and marketing of advertising, food advertising and marketing of unhealthy foods. If you think about these particular articles that are presented here on the left-hand side, lots of evidence demonstrates the positive effect that regulations on food advertising will actually have in terms of its positive effect towards obesity. But again, the governments have tended to delay some of these regulations aimed at limiting the marketing of junk food to children and young people, which again goes against many of the public health efforts to cut down the consumption of ultra-processed foods and sweetened beverages. We also can kind of map this over onto physical inactivity as well. So when we think about promoting active travel, there's been lots of regulations that have been dropped or cut that would not only cut car use, but would also make our neighbourhoods and our communities more walkable and more safer, which again goes against efforts to encourage and support active travel. If you'd like to know a little bit more about these particular issues, there's been some excellent books that have been written in recent years. The slides I'll have links to that you can look at these in your own time. Okay, very briefly then, there's many things that can actually be done to tame capitalism. Significant regulation, as I've mentioned there, and redistribution going to be put in place to counteract the collateral damage and the risk people experience in life in terms of employment, income, and health. And unlike neoliberal free market policies that we have at the moment, which increase economic insecurity, poverty, and so on, and have an adverse effect, including mental health, social demographic models which we see in other nations are capitalist, but they retain a strong emphasis on things like welfare, progressive taxation, and also public investment, which is core to supporting the health and well-being of the nation. But these approaches also maintain economic progress, whilst also keeping inequality relatively low and also living standards relatively high for the vast majority of people. They're able to correct the harms around individual vulnerability to risk, limited provision of public goods, and also the negative externalities that we've alluded to in today's session. And if we look at the evidence in pertaining to the Nordic countries, these provide us with good evidence of the direction that we could actually go. So although they're not perfect, these Nordic countries offer evidence that the social and health costs of neoliberal free market capitalism can actually be mitigated somewhat through social policy and regulation. What they can actually do is correct some of them harms, and given their high performance in some of the alternative measures of social progress that we've alluded to here, they're actually able to score highly in things such as equality, social security, working environment, and alternative measures of social progress like the Human Development Index. And this report will be available to look more closely at after today's session. So now that we've set the scene and we've talked a little bit about poor health in relation to obesity, physical inactivity, mental health, and we've talked about health inequalities and the drivers, we're going to focus our attention now on the workplace in particular. And before we go on to our next interactive activity, we're going to just think a little bit about some of the evidence here. So we think about the data that's come from the National Office of Statistics, from the Health and Safety at Work report. They identified recently that psychological distress, including stress, is the primary cause of work-related ill health in Great Britain. There were almost 1 million cases of work-related stress in 2021-2022. What they also found in a separate article that was published that was based on the global level is the physical health is also compromised by overwork and chronic stress. It actually contributes, according to this study, to over 700,000 stroke and heart disease related deaths every year. And as we mentioned before, chronic stress doesn't just have a direct effect on health, it has an indirect effect in terms of shaping people's lifestyles and shaping the food that they crave, shaping their exercise behaviours, shaping the types of substances that they consume, such as alcohol, drugs, and so on. So our activity now then is to go into breakout rooms. And what I'd like you to actually do is to consider this particular question. I'd like you to actually consider what are the key drivers to work-related stress. More importantly, what can organisations do to limit stress and promote well-being amongst the workforce? Once we've had time to consider this, we'll come back, we'll briefly consider responses, and then we'll conclude with our final section in terms of considering the evidence of what organisations can do, and then just wrapping up the key themes of today's session.
So it'd be great to capture some of the feedback relating to the conversations in the rooms. I did pop in and out of the rooms while you were having your discussions. There were some really insightful conversations. So I'll hand over to Rob to gather some of that feedback and give comment.
Brilliant, yeah, thanks, Gav. Is anyone happy to maybe share some of the themes very quickly from some of their sessions? Is that yes, Gabriella?
Hello, everyone. Good morning. I'm Gabriella, Community Outreach Officer in Northwest London, working in a specific to private area for over 5 years. 3 key points in our group. The first one is related to the support that services are providing to our residents. How are we tackling the issues after COVID-19? They're still here, and we are not addressing those inequalities related to health. The second point is related to the food banks. When you spoke about improving good health, improving quality of eating, we are not talking about the food banks. Who is monitoring the food banks? We are not reducing poverty. We are increasing mentally and physically poverty because it's related to obesity, cardiovascular diseases. So we need to make sure that we start tackling this. We need to review what type of food has been collected by the private residents across the country through food banks. Even the food that some of them produce are not nutritional adequate for communities. Children are suffering in schools. I'm a vice chair for governors. They eat too much processed food at home.
Brilliant.
Parents are going to mental health issues, anxiety. So again, we need to support NHS. NHS needs funding, but there is a responsibility among each one of us, making sure that we support our individuals. And again, having direct conversations about physical activities. We have plenty of free activities for our residents. They prefer stay at home rather than going around the park for 30 minutes. So it's not all about funding. It's about working individually. Thank you.
Brilliant. Thanks, Gabriella. Denise?
Can you hear me?
Yes, yes.
Yeah, hi. So I'm Denise. I'm a children's dietitian. I work in the community in the Wirral. I think our group was a mix of leaders and clinicians, and we shared each other's thoughts on quite a few points. I think we all felt since COVID there was a lot more working in isolation, so lack of opportunity to share worries, chat with team members, and that we put much more pressure on ourselves to kind of keep working at home, you know, continue after hours, not kind of switch off when your working hours had finished. So that was one of our points. There was a lack of breaks. Now a lot more things are on Teams, so we definitely felt that organisations could do with some training on how to manage this to ensure that sufficient comfort breaks are given within meetings, but also that time is allocated after meetings for people to complete actions. Brilliant. Because staff are often felt like, you know, they're running around like headless chickens attending all these meetings without any breaks, but then no time to complete the work that's asked of them. And that in itself reduces job satisfaction and kind of rolls into home life.
Excellent. So I suppose the narrative to that then is around relatedness and providing opportunities and support for people to be able to connect and be related and so on, and being conscious of workloads. Excellent. Yeah. Well, I'm just conscious of time. I've predicted to finish this session at 12 o'clock. So, Arvin, if you tell us one particular point, please, and then we'll cut back. I've been speaking a little bit longer than I expected to. One key point from your session, please, Arvin. I think you're still on mute.
Yeah, so we spoke about the kind of wider insecurity within employment, really. The fact that so many people are on short-term contracts, that creates a huge amount of stress. Work patterns, people doing shift work, working in environments where they get very little daylight. and the harm that has on their circadian rhythms and that sort of thing. We talked about the unequal division of labour, and how that affects women who often end up with most of the childcare responsibility, and the challenges that causes them. And then there are wider economic factors like inflation, how that's driven up the cost of living, and people on low incomes, that's really difficult to make ends meet, and the development of food banks, and the need for a kind of a cultural shift really to help to sort of reduce stress amongst the workforce.
Brilliant. Okay, they're all excellent points. Thanks very much, everyone, for contributing to that discussion. So I'll continue with the slide deck now, and I'm going to do my best to finish up for 12 o'clock. So here we go. So I'm not going to talk too much about this because these particular points have already been raised by the contributions that we've just heard there. But if you're interested in some of these key particular factors that have been highlighted in reports by Mind and some of the evidence, these are some of the points which are very closely aligned to what's already been discussed in terms of how to promote well-being and tackle the causes of work-related mental health problems. One of the points that I wanted to talk about, but I don't think we've got too much time, is actually making that point around the fact that traditionally the evidence would often think about precarious work and insecure work being closely aligned to blue-collar work and physical manual jobs. But actually, as we've seen over the last decade, it's all jobs that have fell victim to insecurity. If we think about academia, I can only talk about this briefly at the moment, but there's many youngsters who've done PhDs, master's degrees, and so on. They may have actually been part of the institution for 10 years, but there's no guarantee that they've actually got stable work. They may actually be on a 1 year or a 2 year fixed contract, but during that time, there's still strong expectation for them to provide a stellar student experience, and of course, engage in many of the other particular activities that's expected them as part of their particular role, with this insecurity as well. But what I want to try and flush out here in this particular section is actually, in many respects, not always, but a lot of organisations, and there's a huge variance in the way in which organisations support the well-being of workers. But in many respects, if you look at some of the evidence in this area, a lot of organisations don't necessarily satisfy psychological safety. A lot of the focus in our society, as well as organisations, is always around adding more things in. What can we do? Can we add more things either into workplaces or other settings, such as communities? But actually, the evidence suggests that one of the more effective things to do is sometimes focus on taking away that insecurity, taking some of the threat out. The argument is that actually not only is it more economically advantageous, but it can be more effective in terms of boosting people's well-being and sense of security. In many respects, it fits to what we talked about earlier in terms of a plaster sticking approach, rather than actually solving that root cause of the problem. What you might have is a lot of these programs, well-being programs in institutions, which are, kind of well received and so on, and have got benefits, but actually if the working environment's quite toxic and if there's a lot of insecurity, there's unlikely to actually have a huge effect in that particular respect. One of the things that I want to share here is the work of David Rock, and I'm briefly going to talk about some of the work of David Rock, but you'll have access to the work of David Rock after today's session and some of the links. The point is that some of the work of Rock is he developed the SCARF model, and the SCARF stands for the 5 key domains of influence on our behaviour in social situations. And he talks about status, certainty, autonomy, relatedness, and fairness. When he's talking about status, he's thinking about our relative importance to others. He's thinking about our ability to predict the future in terms of certainty. He's thinking about our sense of control over events with autonomy. When it comes to relatedness, we're thinking about how safe we actually feel in comparison to others and amongst that group that we're part of. And then fairness, which is a core one for the vast majority of people, in terms of how fair we perceive the exchanges to be in that organisation between people. Now, when we feel threatened, he talks about this a lot, David Rock, and there's been a lot of work that's been done in this area. The release of stress hormones, cortisol, affect our creativity, and they affect our productivity. And these are core reasons why organisations should take heed of this evidence, because it hinders our ability to be able to think straight when we feel insecure. Another thing that we need to bear in mind is that there's a positive aspect to a lot of the work that Rob does. And when we feel rewarded, when we're praised, and when we actually feel a sense of competence, our brains release a different type of chemical. You know, we're thinking here more in terms of the happy hormones. We're thinking here about dopamine. And we're actually thinking in terms of when this happens that we want to experience more of these kind of happy hormones. And that's why a lot of people then seek out opportunities to experience that reward again. So his point here, his take-home message, is that actually organisations and leaders should, where possible, you know, within the constraints that the experience, should work towards eliminating these threats as much as possible, and where possible maximising these rewards, because there are various ways that this can be achieved. In the case of status, as we mentioned here, in terms of, you know, providing people a sense of job security, providing people with praise. One of the points that was talked about in the discussion before was a perception that actually in recent times, them opportunities for relatedness have actually been, you know, largely diminished. So there's actually a lot of cheap and effective ways that companies can actually not only give people security, but can facilitate a sense of autonomy, certainty, relatedness, and fairness. One of the other things that fits squarely with the work of Rob is some of the evidence that's been done in the area around burnout. And Arnold Bakker and Evangelia De Mentori, they developed this particular model, the job demands resources model. And this was developed, I think it was in 2006 now. And what they assert is that all jobs, every job comprises demands, and it also comprises resources. And the model contends that when job demands are high and job resources are low, stress and burnout are more likely to occur, they're more likely to actually increase. And when we're thinking about job demands, as we can see here on the screen, we're thinking about examples that relate to the bad things at work, things that drain our energy, things such as being overworked or feeling overwhelmed, conflicts between others, and future job insecurity. These are all classified as the job demands. But then it's similar to Rock, there's also a positive dimension that we need to consider. And these are things that we call job resources. The good things in jobs, and all jobs have good aspects to them, and it's around things such as support from others, something that was talked about before in terms of that social support, or a perception that actually there's not a great deal of support there available when you need it. Having jobs control and not necessarily being micromanaged, but also having the opportunity for feedback, having the opportunity not just for peer feedback, but also perhaps from leaders and so on. We all like the feeling of not just positive feedback, but also areas that we can develop so that we can move towards our goals. And essentially the model integrates two basic psychological principles and processes. It has a stress process, but it also has a motivational process. And if we think about it here, in the context of the stress process, what it's saying is excessive job demand, as we mentioned before, and a lack of resources coupled together, this leads to mental exhaustion. And companies will then more likely experience things such as a greater sickness absence, more poor health, lack, or shall we say, a decrease in performance, you know, in terms of people leaving the organisation and having a commitment to stay. Essentially, the employees' energy, they argue, is progressively drained, and this is what leads to that kind of burnout. It's a lack of resources, but also them job demands. But then if we look at the right-hand side of our particular framework, there's many things that organisations can actually do. And these are some of the things that very, very closely align, relate to a lot of them psychological theories that we alluded to in today's session. These models, in many respects, map on to some of the work that Decky and Ryan have done as part of their self-determination theory in terms of providing people with opportunities for autonomy, to experience competence, opportunities to feel related. these contexts that support these positively impact not just the motivation of workers, but also their particular well-being. And when we're thinking about it from a security perspective, if we're thinking about the theoretical underpinnings, it's also closely aligned to Maslow's hierarchy of needs and the importance of psychological safety. And we've mentioned there before how safety and security can be provided by giving people, you know, a decent wage, by giving them proper terms and conditions, by making sure that they're not in insecure employment, but they have, you know, a stable contract and so on. If we think about very briefly the term unrelatedness, you could argue that a lot of organisations that have performance-related pay can, in many respects, challenge this collectivist value that you're trying to achieve. You know, if we think about the concept I've mentioned here in terms of football goals, and, you know, you encourage players to score as many goals as possible. You know, when the opportunity arises to actually pass the ball to one of those other members in the team, you know, you could argue that it may reduce his motivation to kind of, you know, pass the ball to one of his players to actually score a goal. There's that kind of collectivist ethos in many respects can be challenged. And we've already talked about safety and security and how that can be promoted within the workforce. If you're interested in this particular area and embedding some of this and monitoring this over time, there's a lot of tools and surveys that are available. One of them that I've shared here is the basic psychological needs satisfaction scale that was developed, 21 items. It's only a relatively short scale. Responses are scored on a 7-point Likert scale, and it gives a measure of autonomy, competence, relatedness, and you can also calculate an overall score. So if this is something that you're interested in doing, monitoring the kind of psychological needs satisfaction in the context of the workplace, this is something that you might be interested in using. Okay, so coming towards the final sections of our talk in terms of, you know, what can actually be done. We have a situation now in society, very briefly, where there's a lot of people who feel stressed because they feel perhaps overwhelmed or overworked. But there's also a section of society, as we've mentioned, who is stressed due to insecurity, underwork and unemployment. So we've got the two sides of the spectrum there, both of the consequences being feelings of anxiety, feelings of chronic stress and so on. And that a proportion of society is overworked and perhaps, you know, consuming excessively maybe, that whilst other citizens in society don't have access to stable work and struggle to meet their basic needs, is one of the key reasons why a lot of advocates of the shorter working week programme, you know, have been so emphasising at this particular point. So we think about the New Economics Foundation, they've published a lot of reports in this particular area. And a lot of the sentiments of their reports are things that have been spoken about over many years, and certainly over a decade ago. And this relationship between overwork and underwork and unemployment is something that's happened for many years and arguably centuries. And I'll allude to here the link that Karl Marx and Friedrich Engels was talking about in the Victorian era. They were talking about this zero-sum game, you know, in terms of it being core to capital accumulation. And they talk about it's notable that when workers work more to earn more money, not only do they condemn other parts of society to work less, they may also assert a negative social influence on colleagues by encouraging them to work more. And this is something, of course, that sometimes organisations, you know, actively encourage, and, you know, this always on culture. And naturally what that often creates and can lead to is creating a culture of working long hours and presenteeism. And this can be an issue certainly for younger people in the organisation who maybe be looking up to leaders and more senior people, because of course they'll be looking to them and following in their particular footsteps. And you can see that in kind of areas such as academia and other kind of industry areas, where perhaps that particular culture is perpetuated then by the next generation coming through. So briefly then, what are some of the things and some of the arguments that the proponents of these particular programmes talk about? Well, they suggest that a policy like this, and we need to kind of also kind of consider the fact that there's not a great deal of evidence in these particular areas to be able to evidence the benefits of these, because evidence is in its infancy. But a lot of the proponents talk about how a greater distribution of paid work can contribute towards reductions in ill health linked to unemployment and underemployment, but it can also lead to greater sharing and equitable sharing of work between households as well. Another point that they talk about is opportunities to live more healthy and sustainably. One of the things we've spoken about today is when people feel that they feel overworked and don't have the time to maintain a healthy and active lifestyle, this can also have implications on health in terms of convenience. It gives people the opportunity to slow down, engage within them 5 ways to well-being that we've spoken about. But also one of the other points that they talk about is the safeguarding the planet's resources. According to them, they mention that perhaps it may break or contribute to breaking the cycle of living to work, working to earn, and earning to consume. Some of the evidence in this particular area, if we think about the recent 4-day week that's been trialled in Spain, it led to employees reporting lower levels of stress, higher satisfaction, and reduced levels of commuting, which contributed to improvements in air quality. If we think about the UK, 61 organisations recently engaged in a similar programme over a 6-month period of time, and it had positive effects not just on stress and burnout, but also worker retention, and it resulted in fewer sick days, which of course has huge benefits for the organisation. But despite this evidence, there's been calls by the government that actually they're against widespread adoption of a lot of these types of initiatives. One of the things that I'd like to finish our talk on, this is the penultimate type of slide, is the work of Robert Sapolsky, which I spoke about before. He won the Genius Fellowship Award for his research linking stress and social hierarchy in savanna baboons. And what he was able to show was that subordinate baboons, those at the bottom of the social hierarchy, what he called the have-nots, had much higher levels of stress hormones. They had increased heart rates and they also had increased blood pressure. But what he also noticed was the males were very aggressive, society was highly stratified and structured, and the women in the troop had an extremely hard time. And one day, about a decade into his research, a calamity hit. A lot of the males in the troop died through consuming food that was riddled with tuberculosis. And he thought that this was the end to his career. So he went away back to the States, and he came back about a decade later. And what he found was amazing to him. It turned out that actually these deaths did not occur by random. What he found was actually if you was aggressive and you wasn't socially affiliative, if you didn't groom other baboons, you were far more likely to die. And he found that the troop's atmosphere, the culture had been transformed because there was twice as many females as males. The males that did remain, what he suggests, they were actually good guys. The troop culture, many, many years later, has low levels of aggression. It's also highly social affiliative, and they're doing this, years after this calamity happened. And what the message of Sapolsky's work is, what he's actually shown is it's not just your rank, but what your rank means in society. He's shown that by changing cultural values, shapes behaviour, but it also shapes health. The troop changed their value system. They don't value dominance and aggression, but rather social affiliation. And changing from a competitive individualistic culture to one that's more collective could enable humans, you could argue, to reap the same health rewards. And to finish, to conclude our session today, I want to make the distinction between taming capitalism and actually changing the economy's goal. And we have a society, as we've talked today, there's lots of evidence demonstrating that it's work dominated, it's stressed out, it's time scarce, it's material abundant, and a lot of people are no more content with their life. And this provides justification for a different course of action. It signals that we need to change the value system, shifting the narrative of the economy's primary goal to the pursuit of growth to one that's geared more towards health, well-being and sustainability. And whilst it might be difficult, there's lots of confidence we can take that actually history tells us that it's happened before. Only 4 decades ago did, Margaret Thatcher set about changing the economic and social outlook of the UK in terms of the vision to change the heart and soul of the nation, whereby, you know, there was strong support for lowering taxes, cutting regulation, and slashing public spending. So the fact that it's happened before should give us reassurance that it's happened again. So finally, you know, capitalism, as we've said today, in its current form, works against many of them goals of the Sustainable Development Goals that the United Nations advocate, not just tackling poverty, but also core to it, achieving healthy future for everyone. The time, I argue, has come to change the goal of the economy and the social progress measures that we actually use. We need an economy that actually maximises human well-being rather than growth at all costs, one that actually values social justice and health rather than material growth. And a well-being economy, and there's some evidence that's developing in this particular area, doesn't just measure the gains to humans and the planet, but it also accounts for them social costs. And there's a range of wellbeing indicators that we've talked about, some of them today, that governments can actually use alongside their economic targets that can support a healthier, more sustainable course of action. Things like the Human Development Index and the Happy Planet Index. And as we've mentioned there, in such a case, the economic tracks would not necessarily solely lead to money and materialism and debt, but to good health and well-being, because everyone essentially should receive a fair slice of the cake and opportunity to achieve a healthy life. So essentially, the main take-home message here is restoring the balance between economic growth and public health has to be a priority of our time, because everyone has the right to a healthy and meaningful life. And perhaps a well-being economy may hold that particular solution. So thank you for your time today. I appreciate it's a long session. There's a link to the book here, and also the QR code is to a sample book chapter. Thank you.